Health Organization, breast cancer remains the most frequent cancer among females worldwide, impacting 2.3 million women and 685,000 women died from the disease. From Croatia, according to data of the Croatian Institute of Public Health, a quarter of women are affected by breast cancer. Breast cancer is the leading cause of cancer mortality among women in the Republic of Croatia.
Dr. Milos,
yes?
I'm sorry for bothering you. I'm sorry. If you want to share with us the screen, we can also follow your presentation.
My presentation is on my presentation
okay.
is
okay, we can share by our side.
Can you see my presentation?
No, we can see you.
You can see me, but but presentation?
No, we can see your face, but not your screen.
And where I put my presentation?
You should share the screen below in the bar. There is like an icon saying share your screen.
Share my screen. The source of participants. Record, stop video participants.
Yeah. It's near that. It's near record. It's near chat.
Share screen.
Yes.
Okay.
Yes. And then you need to select when the window will open. You need to select the screen that you want, the page, the window that you do want, and then you can.
iPhone, iPad, whiteboard, screen, Lucia, what? Share sound, optimize your video now, what?
Share a window. Share a window first, and then we can see all your screen. And okay.
Now?
Yes.
Now
okay.
Now it's better.
Okay.
Okay.
And then now you can open your presentation.
Okay. Here you are.
Yes, fine, thanks.
Oh, yes. Thank you. I can finish school for this.
Okay, no worries, fine.
Okay, that's okay.
Okay, and then below there is an icon like on the right. You can after you can see the written notes and comments below on right. Okay, perfect.
Oh, it's okay now?
Perfect, okay. It's perfect. Thanks a lot.
Thank you so much. Okay, from the beginning, I am Gordana Milos. I'm physiotherapist, magistra, and I'm PhD student. Okay, I have now your okay. In 2020, according data organization, breast cancer remains the frequent cancer among females worldwide, impacting 2.3 million women. Remains the and 685,000 women died from the disease. In Croatia, according to data of the Croatian Institute of Public Health, a quarter of women are affected by breast cancer. Breast cancer is the leading cause of cancer mortality among women in the Republic of Croatia. 2,099 cases of breast cancer were recorded in 2019, and in 2020, 722 women died. Breast cancer treatment can be highly effective, especially when the disease is identified early. Due to increase in breast cancer incidence, advanced in the treatment of the disease have been achieved, therefore lead to improved patient survival outcome, including disease-free survival and overall survival. Despite advances in basic treatment, there are numerous consequences that include, such as fatigue, pain, premature menopause, alopecia, alteration of femininity, sexuality, activities. experience negative emotions, frustration, sadness, anger, increased self-consciousness, and lymphedema. Sexual functioning is an important issue, especially in young women patients, sorry. About 60% of women usually report disruption in their sexual quality of life, which is related to diagnosis at younger age. Treatment with the chemotherapy, emotional distress, psychological issues. This is accurate that younger survivors may need interventions that especially targets their need related to relationship, sexual functioning, and body image. Breast cancer remains the most common complication with a profound and negative impact assessment. The steady increase in survival for breast cancer in recent years has focused attention on how survivors can maintain their quality of life, thereby leading to increased research interest to the sequelae of treatment. Lymphedema is a chronic and debilitating disease. Lymphedema related with the breast cancer occurs in 1 of 5 women after breast cancer treatment and causes significant morbidity. Excessive accumulation of protein-rich fluid in the interstitial spaces with other products of metabolism causes damage to lymphatic circulation. The incidence of breast cancer varies greatly in the literature, ranging from 2 to 83% depending of measurement tool used. The prevalence of reported lymphedema ranges from 0.6% to 54%. Women often report being uninformed regarding awareness of lymphedema and other side effects after the cancer surgery. Although there are numerous risk factors for the occurrence of lymphedema, we find in the available literature low level of experience, awareness, and knowledge about lymphedema. There is noticeable low level of education about breast cancer patients before surgery, during the treatment, in the recovery and survival, and has a high impact and poor quality of life. Lymphedema is sequela of breast cancer treatment result from disruption to the lymphatic system that prevents drainage from lymph vessels, causing protein-rich fluid to accumulate in interstitial space. Lymphedema is defined as persistent tissue swelling caused by the blockage or absence of lymph fluid. Surgical removal of lymph nodes under the axilla pit is a part of breast cancer treatment. Axillary lymph node dissection has an important role in management with lymph nodes were removed. Evaluation of axillary involvement in standard technique of sentinel lymph node biopsy in the last 2 decades. The progression of breast cancer related lymphedema is related to various risk factors such as endocrine therapy and high body mass index. Lymphedema complications include infections like erysipelas, cellulitis, and lymphangitis. There are 4 stages of lymphedema. In stage 0, the latent or preclinical stage, at this stage, the patient is at risk of developing lymphedema. However, no swelling or other visible evidence of impaired lymph transport is present. In stage 1, when the skin is pressed, the pressure will leave a pit that takes some time to fill back in. This is referred to as pitting edema. Sometimes the swelling can be reduced by elevating the lymph for a few hours. It is usually reversible. In stage 2, when the swollen area is pressed, it does not pitch and the swelling is not reduced very much by elevation. In left untreated, the tissue of the lymph gradually hardens and become fibrosis. In stage 3, the lymphedema is often referred to as lymphatic lymphangiectasis. It is very serious disease and should not be taken lightly. It occurs after progressive long-term and untreated lymphedema. In this stage, there are many stages on the skin: fibrosis, papilloma, keratosis, and fungal infections. There are many, even by some leakage of fluid through the tissue in the affected area, especially in the when if there is a cut or sore. While first and the second grade lymphedema will respond to treatment, at the third stage is rarely reversible. It's frequently result in complications such as lymphangitis. It's a bacterial infection. Breast cancer related lymphedema have a strong influence on self-assessments, on quality of life, poor functional recovery, chronic disability, impaired quality of daily life activities, and because of discomfort due to negative body image may result in physical, psychological consequences which can negatively impact of quality of life and compromise emotional well-being. Breast cancer lymphedema can physically impair arm functionally function but limited range of motion, as well as causing feelings of pain, heaviness, numbness in the upper extremity. It is dealing with this physical, professional, social, and psychological difficulties. Specialization and education are necessary for healthcare professionals who will have time and knowledge to educate patients. There is a visible lack of effective educational protocols for raising awareness about lymphedema. Low level of awareness and knowledge about lymphedema has a major impact of poor breast cancer treatment outcomes. An interprofessional team is recommended to achieve the best lymphedema management. The first step is recognition and early diagnosis of by primary care physician or with the physiotherapist. Since most cases are related to neoplasma and post-surgical issue, surgeons and oncologists with a solid foundation in the lymphedema recognition, prevention, and treatment is essential. The addition of the certified lymphedema therapist rounds out the team. When lymphedema is diagnosed late, treatment can be expected to be less effective. Post-treatment, patients suffer from the side effects and they have various rehabilitation, which means that individualization is fundamental for optimal rehabilitation. The recent study by Renz emphasizes the needs of rehabilitative comprehensive interventions in cancer patients, including physical activity, not only for the positive effect of lymphedema, but also aiming at improving the quality of life of cancer survivors, given the positive effect in physical performance, physical function, depression system, sleep disturbance, fatigue, and most of the disabling symptoms commonly reported by cancer survivors. Due to negative impact of breast cancer-related lymphedema, educational intervention has the potential to increase the individual awareness of risk factors, early signs and symptoms, and treatment options that could lead to early detection and better control of breast cancer-related lymphedema. Once lymphedema develop, education is also needed on skin hygiene, prevention of infection, and self-care practices. Healthcare professionals and those diagnosed with the breast cancer agree patient education component of both prevention and treatment of lymphedema. However, individuals diagnosed with the BC reported having inadequate knowledge and its sequelae across the trajectory of survivorship. Sorry. Contributing factor may be the lack of guidance for healthcare professionals and can develop an educational intervention throughout survivorship. Educational plans and recommendation from BC survivors who have at the risk of lymphedema, although some risk factors for breast cancer are not modifiable, they are potentially preventable through patient education and physiotherapy. Educational program may increase the awareness of lymphedema and reduce the risk of lymphedema with the lifestyle modification. The main solution for breast survivors who have at risk of lymphedema and providing information, patient education for preventing lymphedema or reducing the risk of developing a severe condition. Patients with breast cancer who have lymphedema have high needs as regards concise lymphedema information. Private sessions with physicians, physiotherapists, and lymphotherapists and social network can prevent detailed information for them. Physiotherapists with special knowledge of lymphedema have a key role to play and ensures women receive holistic and individualized care. Patient education and rehabilitation that begins before oncological therapy and surgery. Patient education and rehabilitation begins with the first week post-surgery and is followed by physiotherapy is effective in reducing the risk of lymphedema in women who undergo breast cancer surgery with the axillary lymph node dissection or sentinel lymph node biopsy. Although exercise therapy is widely recognized to have a role in breast cancer lymphedema management, a large number of barriers still limit physical activity in these specific patients. Early and appropriate treatment is essential. Combined physical therapy or complex decongestive therapy is a recommended treatment for lymphedema, and the complete decongestive therapy is the gold standard worldwide. Manual lymphatic drainage, a type of hands-on therapy, is frequently used for breast cancer patients, often as part of complex decongestive therapy. Complete decongestive therapy is for conservative treatment, which include skin care, manual lymph drainage, compression therapy, consisting of compression bandages, compression sleeves, and other types of compression garments. Lymph reducing exercise with bandages or with compression sleeve, and of course, educations for a patient and their family. We see patients who have increased knowledge of awareness of the this patient with whom lymphedema are apart the knowledge to manage and control lymphedema. They know everything about complete the congestive therapy and who they can turn to for help. Breast cancer patients have a sense of social support and better quality of life. And breast cancer affects women's identity and therefore studying quality of life for those who lose their breasts. In conclusion of breast cancer survivors, patient awareness and education out about postoperative lymphedema risk after the cancer surgery is warranted. Breast cancer mortality is decreased due to improved diagnostics and treatments. As survival is increased, the long-term sequelae of treatment and impaired quality of life become relevant. In the review of the literature, we found many papers and researched the treatment of lymphedema, knowledge, and raising awareness. Lymphedema among breast cancer survivors, but we didn't not find a correlation between knowledge, awareness of the risk of lymphedema, and quality of life among breast cancer survivors. Levels of awareness and knowledge of lymphedema and correlation with breast cancer quality of life among breast cancer survivors would be a possible topic of our research. Thank you for attention. Thank you very much. If you have some
Many thanks for your nice presentation, Gordana. Many thanks. See if we have any question for you.